As more and more people test positive for COVID, doctors are warning lingering COVID symptoms are more common than you might think. At least 1 in every 10 people seem to be developing long COVID, and it can be life-changing. New tonight, WCNC Charlotte's Chloe Leshner spoke with a North Carolina doctor trying to help those patients.
More than a year after catching COVID, persistent symptoms have kept Brooke Keaton from going back to life as she knew it.
But I did not think that it would cause me or others to still be sick months and now a year or more later.
She can't work, and taking care of her own kids is difficult. Doctors have told her she's a long hauler. She shared her story with WCNC Charlotte, catching the attention of Dr. John Barada, who's now trying to help her.
There isn't a clear understanding in the medical community of exactly what causes long COVID and why some people would get long COVID and others wouldn't.
Barada founded the UNC COVID Recovery Center, seeing patients from all over the East Coast. He says it's been a challenge. Every person has a different experience with long COVID, but most of his patients are struggling to return to normal.
Not everyone has had a complete resolution or a great improvement, but many have, and I think that is something that should be encouraging for someone out there struggling with long COVID symptoms.
Fatigue, respiratory issues, chronic pain, difficulty with memory or attention, and anxiety or depression are common complaints. Doctors tailor the recovery program for individual patients, working to treat those symptoms.
I feel like we, through our work, are really able to positively impact their recoveries and their lives.
In Impact, doctors say 10 to 30% of COVID patients could continue to feel well after the pandemic ends. Chloe Leshner, WCNC Charlotte.
If you'd like to learn more about the UNC COVID Recovery Clinic, here's the number to call. It is 984-974-9747.